Welcome to Project Unity, a youth-led organization working to bridge the worlds of public health, medicine, and digital health. Our mission is simple: empower the next generation of changemakers to drive innovation, collaboration, and equity in healthcare through an evidence-based, interdisciplinary, and community-driven approach.
Catalyst Academy is our flagship summer program that equips high school students with the tools to tackle real-world medical issues through a public health and digital health lens. Over the past 8 weeks, students learned from healthcare professionals, engaged in hands-on research, and designed innovative solutions tailored to their communities. This summer, their collective efforts led to powerful results. Let's take a look.
The Unity in Public Health Research Conference serves as a culmination of all of our students' hard work this summer. Our theme this year, Innovation in the Age of Misinformation, is more pertinent than ever. In today's healthcare landscape, inaccurate and misleading information can spread faster than the truth, and the consequences are real. But misinformation doesn't just challenge what we know, it challenges how we lead. That's why this summer, our students took on the issue head-on, learning how to communicate clearly, question critically, and innovate responsibly.
In a world where false health claims spread faster than facts, Catalyst Academy empowered us to be trusted messengers. For one of our assignments, we translated complex health research into accessible content for the public. This included using blog posts, social media, and even short videos. Our public health messages were backed by research and expert sources, but written in a way my friends, family, and community could understand. At Catalyst Academy, we learned that stopping misinformation starts with how you communicate.
We also led peer discussions on current public health events, helping each other think critically about the information that we see and share. It was powerful to see open conversations and with grounded science change perspectives. This experience taught us how to be effective communicators and how to use our voices to build trust. Catalyst Academy ultimately gave us the tools to be able to communicate clearly, confidently, and compassionately.
At Catalyst Academy, we didn't just learn about misinformation. We learned from public health and digital health leaders who are actively combating it. Guest speakers showed us how misinformation thrives when communication fails, especially in digital echo chambers, and what strategies can actually make a difference.
We explored the importance of trust, storytelling, and cultural awareness in public health messaging. From learning how to break down complex topics to understanding digital misinformation tactics, our incredible lineup of guest speakers taught us what it takes to communicate for impact.
It is my privilege to be introducing one of my amazing mentors, Dr. Ami Butt. She's a nationally recognized leader in digital health.
Misinformation can also be an act of exclusion, though. So, AI doesn't understand subtle nuances that are critical in complex medical care.
I'm Catherine, and Anushka and I are going to talk to you about misinformation, public health communication, and dose of truth. Falsehood being about 70% more likely to be retweeted on Twitter, and with false news generally traveling about 6 times faster.
So happy to introduce Carolyn Robeck to help expand on this concept of epidemiology.
But we want to use our data to make things fun and interesting and engaging with folks. So we put ads in the subway, we put ads online.
In our research projects, we started by looking at how health misinformation shows up in our own communities. Through literature reviews and community interviews, we uncovered the deeper roots of the issues we care about, from mental health stigma to nutrition myths.
Then we turned those insights into action. We designed public health interventions grounded in evidence and community voices, integrating digital health solutions and crafting step-by-step plans to make tangible changes in our local community over the next year. Catalyst Academy showed us that innovation starts with listening and ends with impact.
Hi, I'm Dave Choksi. I'm a doctor at Bellevue Hospital in New York City, and I also serve as chair of the Common Health Coalition. To me, what sets Project Unity apart is how it empowers students to tackle real-world healthcare challenges with both knowledge and purpose. For example, through the Catalyst Academy, students are not only learning how to navigate misinformation, they're exploring how digital health tools and equity-centered approaches can transform the way we deliver care for everyone. In a time when trust in healthcare is fragile and disparities persist, it's truly inspiring to see young leaders designing innovative solutions that are both tech-forward and community-driven. You remind us that the future of healthcare is not just about new technologies. It's about who those technologies are built for. Thank you for this important work.
Thank you to our advisory board, Unity leadership team, Catalyst mentors, and guest speakers. Your guidance has helped our students navigate complexity with clarity.
To our incredible students, your drive to lead with truth, empathy, and innovation gives us hope for the future of healthcare.
Join us as we continue to empower the next generation to rise above the noise and build a more equitable, informed world together.